Where does not automatically mean loss of vertical dimension so that it goes for full crowns everywhere. These yellow cases appear to be dramatic, and that is why they end up being treated for blackout cases. So imagine that you are driving in a city. At every intersection, there is a traffic signal: green, yellow, red. So you don't argue with those signals, and you don't even suddenly accelerate or take a break all of a sudden for no reason. You just look at the signal and respond accordingly. Dentistry is similar. Every mouth that you see is a signal showing you the state of flow of biology inside the patient's mouth. So, when you look at the green signal, the traffic is flowing smoothly. That's what you know. Nothing is wrong, and you don't need to change anything. When the signal looks yellow, you understand that something is changing. You don't panic, you just slow down and stabilize the situation. And when the signal looks red, you know that you have to stop and correct the situation before you can go ahead. Because if you ignore that red, you know that damage is bound to happen. And sometimes there is blackout. No signals, no control, and complete chaos. This is the system collapse. Now, even biology shows you these kind of signals. So here the green signal looks like a healthy mouth. A yellow signals in the mouth looks like an early disease. Red signal looks like structural damage, and blackout looks like significant loss of structures. Here the fact is that the number of cases with yellow signal are more prevalent than number of blackout cases. But sometimes these yellow cases appear to be dramatic, and that is why they end up being treated for blackout cases. So dentistry is not about restorations, implants, dentures. It is about reading the signal of biological flow and responding. So here the clinical wisdom is not in knowing more and more procedures. It is in knowing which procedure is supposed to be used when. So you read the signal before you choose which treatment to proceed ahead with. Let's take up examples. Now you've got a young patient coming to you, and the patient has generalized attrition. The patient is not showing any discomfort with muscles, has no muscular pain. The TMJs are also working fine. The video is the vertical dimension that we say is not collapsed. And the posterior support is also okay. But this looks scary. There is generalized wear everywhere. Here you don't need to panic. Identify this as the yellow case which just needs to be stabilized. Here the wear is because it is compensated. This is just the early disease. You stabilize it at this point, it will not progress. Many times we also get to see deep bite cases with a lot of wear. So you may feel that it may go for a full mouth rehabilitation. This also looks like a blackout case, but it is a yellow case. Whatever wear that you are seeing in the patient's mouth is probably because of the deep bite. Mind you, a deep bite with a stable contact is one of the most stable dentitions. Yeah, but if that stable contact is something which needs to be worked on, then it shows up like this, which most of the times has the guidance problem. And here you need to identify it as a yellow case, stabilize, and protect from further damage. This is also early stage. So in the end, I would again conclude saying that the final goal is not perfection. It is flow. Your patient has to be comfortable and functioning without pain. Thank you.